This is what a lot of folks are going to be chatting about today. The new guidelines this morning on who should be wearing a mask and when.
If you are fully vaccinated, you can start doing the things that you had stopped doing because of the pandemic. We have all longed for this moment. Based on the continuing downward trajectory of cases, the scientific data on the performance of our vaccines, and our understanding of how the virus spreads, that moment has come for those who are fully vaccinated.
People have to make their own personal choice. What you heard from Dr. Lewinsky, well, is the recommendation based on science. And that's just a recommendation. And when people want to do that, they at least have the science behind them.
Okay, the new federal recommendations, a sign that we have really turned a corner in this COVID crisis, but don't throw away your masks just yet. Dr. Shereef Elnahal, the CEO of University Hospital in Newark, he is joining us now to help us clear up some confusion about when and where masks may still be necessary. Good to see you, Dr. Elnahal. Thanks for being here.
Good morning.
Great being on as always.
This is certainly a big day, one that many people waited for, right? They're tired of wearing these. They don't want to do it, especially with the warmer months coming. However, you look at New York and New Jersey, right? The governor's there saying we're going to review the information here. What does that mean?
Well, it means that the relaxation among businesses and institutions and places that are regulated needs to really be reviewed before it can be fully executed. And so what this guidance is telling you is that if you're fully vaccinated and you're following state guidelines, then you can actually not wear a mask indoors depending on where you are. But this is really good news, especially for household gatherings. If you're pretty sure that everybody involved in the household is vaccinated, but even if you're not in terms of your guests, you can actually invite them now for a household gathering if you're fully vaccinated. And so you don't have to wear a mask in that scenario. That's a really good piece of news. But you do have to follow state and local guidelines per the latest CDC guidance. And part of that is because we can't really verify if somebody's vaccinated yet. And so if a business, for example, completely removes the mask restriction, we're still on the honor code for folks, whether folks are vaccinated or not.
Well, not only that, doctor, with the honor code, some folks are saying, hold on, let's pump the brakes here just a second because, you know, children aren't fully vaccinated either, and they can transmit this. And then, like you say, we don't know how many people have only gotten one shot.
Exactly. And so I think for folks who are partially vaccinated, this guidance does not apply. And so this is yet another incentive to not only get vaccinated in the first place, but to complete vaccination if you've had your first dose. Unfortunately, we've seen more and more people over time not get that second dose, even if they've gotten the first. I think it just reflects the motivation for folks to get vaccinated in this next group that we're trying to vaccinate. And so really important to follow the guidelines to the letter. And if you're partially vaccinated, they do not apply to you.
So the assumption, right, you see somebody walking down the street now, because, right, I got to say, there's still that look you get if you don't have your mask on, right? You don't have it on, you're walking down the street, someone kind of walks a little further on the other side of the street, they're like, whoa, not so fast. Is the assumption that if you're not wearing one outside, that you are fully vaccinated, right?
Well, we've been asking people to do the right thing, and part of that ask now is to make sure that you follow the guidelines. And if you're not wearing a mask, we will assume that you are fully vaccinated. And so I think people really have to follow that honor code for this to work, unless we have vaccine verification. I know that vaccine passports are highly controversial, but depending on where you are in this country, certainly in New York City, you know, businesses may want to know if you're vaccinated if they fully reopen, especially if it's a crowded indoor space.
Let me ask your personal opinion on this. Is this a little too fast? I know it's the CDC says it's backed by science and all, but we're not at herd immunity.
We're not, Betty, and that's a very important point. I think the risk of folks not following these guidelines and, you know, pretending like they're vaccinated and showing up without a mask is higher in places, obviously, that are not as vaccinated. And so the city of Newark, unfortunately, is still only about just over 40% who've gotten just their first dose. And so, you know, these risks are higher for places, especially urban areas, unfortunately, communities of color in particular, where you're not seeing as many people vaccinated because of access. So that's very important.
Let me ask you then what you're seeing at University Hospital, right, in terms of cases and whatnot. because people are saying, well, the case numbers are so low now. Yes, we're not at herd immunity yet, but the case numbers are certainly going down, trending in the right direction. What are you seeing at University Hospital, and how many people would you say in New Jersey aren't vaccinated?
We're seeing a much better situation with regard to patients in our hospital. We only have about 15 patients now, down from a high of over 50 just a couple of months ago. And so I think the pandemic is moving in the right direction, but we're not really near the 70% fully vaccinated threshold yet. The president set a goal of July 4th for that for the whole country. But remember, it's not the entire country that we have to worry about, it's your community. And so, these guidelines, while they are based on evidence, in terms of implementing policy like removing mask restrictions, you have to consider where you are, as Betty mentioned, in getting to that goal.
Well, and then you've got these other situations that come into play that are a bit mysterious, right? Let's talk about the Yankees. 8 players who have been fully vaccinated still tested positive for COVID. So how does that play into this?
Called breakthrough cases. What does it even mean?
Yeah. So a breakthrough case is a case of COVID-19 you get after you are fully vaccinated. And so the CDC is getting reports of that. I do think there's underreporting because it's not automatic. And so it's important to understand that the Yankees are okay. Only one person showed any symptoms, and thankfully it's mild. But my concern is that these are players that are heavily monitored. They're tested all the time. And so I wonder about breakthrough infections and whether we're capturing all of them, especially for folks who got the Johnson & Johnson vaccine, which the Yankees did get.
So they did get the Johnson & Johnson,
yes,
the one-shot dose. We shall see. There is so much to dive into. We could do a whole hour with you, but we're out of time.
All right, Dr. Elnahal, thanks so much. You always try to clear everything up for us, and we appreciate your time.
My pleasure. Thank you.
Thank you.